Hello, I'm Jeffrey Ingalls, President of Stratford Financial Group and Stratford Employer Services in Wayne, New Jersey. And right now we're going to talk about how to evaluate group health insurance, HMO, and PPO plans. In order to evaluate both plans, you need to perform a series of comparisons and equations to determine which plan is the best and right fit for you. The first equation would be a network equation. You need to determine the listing of participating providers under the HMO, as well as the listing of participating providers under the PPO, and see which will best accommodate you. Next, you need to perform a value equation. The PPO plan will provide out-of-network benefits, and you need to determine or evaluate the likelihood of needing those out-of-network benefits under that plan design. Secondly, you need to determine the differences, if any, in the actual coverage or covered services under the HMO versus the PPO. Next, you'll need to perform a financial equation, and to do so, you'll need to determine your likely out-of-pocket under the PPO plan as well as the HMO plan. So again, you'll want to take a look at the deductibles, copays, coinsurances, and maximum out-of-pockets associated with each plan to enable you to do so. Once determining your likely out-of-pocket under each plan, you'll want to add that figure to the premium or employee contribution required for the PPO versus the HMO and determine which plan will be the best financial fit over the course of a given year. By asking yourself these questions and performing these equations, the right choice, HMO or PPO, should become clear. My name is Jeffrey Ingalls. I'm the President of Stratford Financial Group and Stratford Employer Services in Wayne, New Jersey. We can be found online at www.stratfordlink.com, and you just watched how to evaluate group health insurance HMO and PPO plans. Thank you.
Do I have to get health insurance, and if so, when? The new healthcare law requires most Americans to pay a fine if they don't have health insurance, starting January 1st, 2014. But most people don't have to worry about this, since more than 80% of Americans have insurance through work or government programs such as Medicare or Medicaid. And people in certain categories won't have to pay a fine even if they go without coverage, including certain religious groups, American Indian tribe members, and people who don't earn enough income to file a tax return. There's also an out for people who'd have to sacrifice more than 8% of their income on top of whatever financial help they'd get from the government or an employer. The Congressional Budget Office estimates that 6 million Americans will have to pay the penalty for going without coverage. The penalty starts at $95 or 1% of family income, whichever is more, and goes up in the years to come.